So the overall summary presentation of the Capstone project for the current nursing issues in Ontario, Canada. So the title is to reduce the hospital acquired infections and antimicrobial resistance by 2024. So this capstone presented by Jose Tanson and Magallanes, a student of Seneca King, NLM 200 KDD, and my professor is Kelly Russo, March 19, 2023. So learning objectives. The presentation aims to number one, define the hospital-acquired infection and antimicrobial resistance. Number two, what are the solutions for the hospital-acquired infections and antimicrobial resistance? Number three, what are the nursing leadership theory or style that are applicable and expected outcomes for this? So we have last number four, we have the brief outline and sustainability solution for the next 5 years. So the overall goal of this project is to reduce the number of the hospital-acquired infections in antimicrobial resistance in all hospitals in Canada, Ontario, specifically the Ontario, by 2024. So now let's define the hospital-acquired infections in antimicrobial resistance. So according to the Government of Canada 2022, this affects Ontario and global hospital. Nosocomial infections are hospital-acquired infections that caused by bacteria, virus, fungus, and infections, which may vary from mild skin infections to life-threatening disorders. Antimicrobial resistance occurs when bacteria, virus, and fungus um, develop resistance to their treatments, such as antibiotic, which may lead to antibiotic abuse or overuse might create the resistance. So to achieve the goal and to reduce the hospital-acquired infections and antimicrobial resistance in all hospitals in Ontario by 2024, several strategies or solutions that can be implemented, including number one, we have the enhanced infections preventions according to SCNI 2020. It includes the proper hand hygiene, the proper use of PPE, disinfections, and the proper waste disposal. Number two, we have the stewardship program. It's according to Leong et al. 2018. These programs helps to optimize the use of antibiotics in each hospital in Ontario, ensuring that the antibiotics are prescribed and effective. So now we have the surveillance or tracking cases, the use of the information control. Patient's education, where the patient can learn about antibiotic effects and how to use it. We have the and communication. The proper collaboration and communication between the health worker or health provider, patient, and the policymaker to sustain the effectivity of the infection prevention measures. Overall, the implementation of these strategies will require investment in terms of resources, trainings, infrastructures. However, the benefits of this is to reduce the hospital-acquired infections and antimicrobial resistance uh, of improving the patient's outcomes and to reduce the healthcare cost. Okay. Nursing leadership theories and expected outcomes. So transformational leadership theories. I choose this one because it emphasizes the need for the leader to inspire and motivate followers to achieve common goal. Transformational leadership theories inspired and changed by building trust, fostering collaboration, and this type of leadership can help to reduce the incidence of hospital-acquired infection and antimicrobial resistance by promoting a culture of safety and accountability and continuous improvement. When it comes to the expected outcome, it, it is um, it is the reduction of a number of infections and antimicrobial resistance rate in all hospitals in Ontario, Canada. So when it comes to the brief outline and plan in sustainability solution that will be implemented for the next 5 years. So I give number one, the policy change. Number two, the education and awareness campaign. Number three, the infections prevention and control measure. And number four, the antimicrobial stewardship program. And lastly, the number five, the sustainability solution, which ensure the sustainability of the plan and continuously monitoring and evaluating the uh, effectiveness of the interventions, making the necessary adjustment for it. So this is my reference, Government of Canada,